Welcome everyone to the Built for Zero Canada Quarterly Update webinar. So glad that you could join us today. This is a webinar that we hold periodically 3 to 4 times throughout the year to talk about progress, to kind of summarize the activities that are coming, and for those that are on the call, get a sneak peek about what is coming up over the next quarter. Our last quarterly update was in the end of October, so we are kind of doing everything November to February in terms of an update on this one. So this is Marie Morrison. I'm the Director of Built for Zero Canada. I am your presenter and host for today's webinar. Sometimes we have other staff joining us, but today they were not available. I'll be presenting some information on their behalf. You are stuck with me today. A bit of housekeeping. The webinar, as always, is being recorded, and it will be sent out later today to all of those registered along with the PDF, so you can access any of the links in the presentation. It will also be included in next week's Built for Zero Canada Updater, and will be posted on our website under Campaign Resources, then under Webinars, and under Archived Webinars. And everyone is muted, and you can ask questions throughout in the question box or the chat box. I'll be monitoring those as we go through. So why we are gathered here today, why we are participating in this joint effort together. Built for Zero Canada is an ambitious national change effort helping a core group of leading communities end chronic and veteran homelessness. And I know you're sitting there at home with your hands up, cheering in celebration, knowing that we can end chronic and veteran homelessness, and that's really going to set the path and be the first step to eliminating all homelessness in Canada. Built for Zero is one of 4 key initiatives of the Canadian Alliance to End Homelessness, including the conference, training and technical assistance, and allied networks. And we're always thankful to our funders, Veterans Affairs Canada and Employment and Social Development Canada, who are not only funders, but also thought partners in our work together. Our agenda today, we'll be doing some activity highlights from November to February, and you can see the list there. And then let's get excited. We're going to talk about community and campaign progress over the last 4 months. And I think I always enjoy these because sometimes it might feel like not a lot's happened or we're not making a lot of progress. And we had December, which is sometimes a slow month with all the holidays, but there has been a lot of progress made. So let's get excited. We're going to look at some upcoming sneak peeks, and then we'll have some time at the end for questions. All right, so into our activity highlights. This is the current Built for Zero term that we're in that started in November 2018 and wraps up in June 2020. We just had a January learning session in Toronto. We are in the middle of an action cycle right now where people are putting into actions the plans that they put in place in January. And then we'll have another learning session, the last one of the term, in June. And we are in the middle of a sign-up period for the next term right now. So we're going to just touch on all of those points. So in terms of the 2020 learning sessions, oh, we skipped ahead there. We had a great learning session in Toronto. The theme of that one, given it was January, given it was a new year, given it's a new decade, was on setting our vision and our sights on ending chronic homelessness and getting really clear, developing 2020 vision and clarity on where we want to go and how we're going to get there. And we celebrated progress, and we had rock and roll bingo, and we had our vision posters and meetings together and conversations with partners, and it was a great learning session. We had 166 participants, 148 individuals from 28 communities, which is our largest learning session yet. We also had 18 partners and funders. All materials from the learning session can always be found on the change package, and the password is there under learning session along the top of the drop down, and then January 2020 page, and I've linked it in there, and you can find the agenda and the presentations. And if you're trying to find someone that you met there, there's the contact list of attendees. All of the vision boards are available through there, but they are also in your own change package page. If you wanted to do rock and roll bingo at home, there's the card generator and the music playlist from it, and Also pictures, lots of pictures. So if you're working on a newsletter or wanted just to bring something back to your team, you can check the list of pictures there. And we missed adding in the ones that were all of the celebrations of the schools and the t-shirts and that sort of thing. So those have now been put in there as well. And we have just released the learning session evaluation report. It's now available on the change package under January 2020. And this includes all the feedback you gave us from the live and follow-up surveys. And we use that along with the continuing conversations we're having with you and our team and our partners to shape the agenda for the next learning session. So let's talk a little bit about the next learning session. It's going to be in the same location as January, the Hilton Toronto Airport Hotel and Suites. And we've had some feedback that people would prefer to be in downtown Toronto. And I will just say that we book the hotels in blocks because that helps us get the best deal. We're looking for the best space within our budget that also gives you the best room rate. And so this is the one that offered that this time. We'll be looking around for what hotels we can access in 2021. But again, we grew out of the one that we were in downtown Toronto already. So again, it's about finding the best, most usable space at the best deal for you folks. So our next learning session is on June 4th and 5th. Again, it's a Thursday and a Friday. That's not our preference of days. We would rather do it on Tuesday, Wednesday, or Wednesday, Thursday. But again, that's when you're able to get the hotel. So the registrations have been sent out to the leads and data leads. So you can start to gather your team together and start to register. And the deadline for registration in the hotel group rate is May 15th. And we really encourage you to book your hotel early. Sometimes we do run out of rooms, and if the hotel is full, we cannot get new rooms. And also it helps us in our planning and to know that your team is together. So please try to register as early as possible. That's just helpful all around. All registration and preparation materials can be found on the change package. So if you lose that email, it's always, again, we've now created a new page for June 2020 and all the materials are there. And then once you register, you'll be automatically added to the learning session orientation webinar, which we encourage everyone to attend the first part for sure, where we review the agenda and just make sure everyone knows what they're getting into and can come prepared as possible to get the most out of the learning session. If you have new team members, the second half is really focused on a more general overview of Built for Zero, and it's a great orientation for them. So encourage everyone to tap into that orientation webinar either while it's happening or the recording that gets sent out afterwards. So we're getting ready for our next term, which will take place July 2020 to March of 2022. Existing communities have the first chance to sign up. And I would say 2/3 to 3/4 of you have already signed up, which is great. There's the form, it's due at the end of this month. The options were in person, choosing chronic only, or to sign up for chronic and veteran. And the virtual, there's 4 communities who are in a virtual collaborative. Only they were invited to continue within the virtual, but they could also choose chronic only or chronic and veteran. And as we get those sign-up forms in, we're sending out agreements and invoices, and they need to be signed and payment made by May 29th, 2020, because we're trying to figure out how many new communities we can add in who would like to join us. New communities will be invited to apply over May and June for any available spaces. We know there's one space, so we know we're going through the process. We just want to see if there's any more space. And this is really capacity-based. We'd love to add more, but our current capacity to offer the best support to reach our goals, we think we're kind of maxed out right now. And so we're trying to always get additional resources, but we are limited by capacity. We anticipate the application process to be similar to last year's process, which is linked into a blog there with all of that information. And then that same as this past year, new communities would be selected in July and be onboarded over the summer and fall and enjoying the first learning session in January of 2021. So at the last learning session, we also launched the veteran community cohort officially, and you can see the group there, and there's a blog that we did around that launch that you can link to. So since we met last, we have added Amanda DeFalco to our team. Very excited about that. She started with us in January as an improvement advisor, and she is serving as our team's strategic lead on the veteran work. And she is busy developing relationship with veterans partners and building up resources and strategy in that regard. She is coaching 8 initial veteran communities who signed up. And those early adopter communities are listed here, and they're helping us test materials and resources. And we've already had communities identify that they're planning to sign up and are wanting to be part of the cohort in July, starting in July. So just again, the rationale of why we're focusing on ending veteran homelessness. We believe we do have a duty of care to all people experiencing homelessness, but especially and also veterans who have served our country. And we think it's an opportunity to shrink the change. Veterans are a well-defined population where we think rapid success is possible. So we're seeking to reinforce and support the efforts that are already happening with veterans organizations and continue to build those partnerships and coordination. And we believe that it will help us achieve progress on ending all homelessness. So if we can show proof points for one population, it can get us excited about showing that it's possible and that we can do it for other populations. And it's helping us build the local infrastructure, I think, for ending all homelessness and our campaign infrastructure in terms of data and visualizations to support that work. And it's an area of federal accountability, which I think can strengthen kind of federal leadership for ending homelessness. And we are working with Veteran Services and Supports and working to develop those relationships. Veterans Affairs Canada and the Legion were at our last learning session. We've been talking a lot with the Respect Forum, who do forums in a number of communities in March and October, bringing together first responders, vets organizations, and the homelessness sector. So we're really working with them closely for this next set of forums that happen in communities. We're also starting to build a relationship with soldiers, helping soldiers through Defence Canada, and reaching out and working to develop that partnership with Vets Canada as well. So some of the resources and supports, there is a Built for Zero website page specifically around veterans. It's available to everyone. There's a video there that speaks to the definition of veteran functional zero, which is a bit different than the chronic definition. It's more of the definition that we would use for all other non-chronic populations. There's pre-recorded webinars and community practice calls. Ali with ACRE has developed a HIFIS Built for Zero veteran report that we're testing right now to pull out the 6 data points, hopefully making that easier for communities. There's all of the scorecards and data submission forms and whatnot that we're testing and working through now. And Amanda set out a veteran survey to all of the community cohort to better understand how we can help tailor resources and supports. One of the upcoming community of practice calls we've been advertising is listed here, and you can register the link. Everyone, even if you're not part of the veteran community cohort, is welcome to join in on these resources and these community of practice calls. So what we heard from that veteran survey is that 86% found the existing veteran webpage helpful, particularly the homeless definition and the tools and resources. There's also a whole section on partners pointing you to the work they're doing around homelessness and how you can get linked up with them in your local community. And top picks for veteran community of practice call topics are listed there. And we listened, so these are some of the upcoming community of practice calls that are coming. There's one with Veterans Affairs Canada and the resources and supports that they offer and how people can connect with them in communities. That's happening on April 30th. You can see all of them as they get organized in the coaching sign up, and then all the recordings are available on the action cycle page. And we also are doing some pre-recorded webinars with Jen Richardson, who had worked on the community research project that took place across Canada in 2012 to 14 to talk about that project and some of the really practical resources that came out of it, and doing more of a Veterans 101 kind of the culture and making sure the homeless sector understands more about the military and veterans sector. So the next thing to provide an update on is the homelessness definition clarity project and report. That report is now available on the change package. This is some work that Jessica did with communities last summer to better understand how you were defining chronic homelessness, so we could understand the context of your data, but also because the feds had recently released their new definition, and we wanted to understand if people were adopting that definition and what supports they might need. So she has, just today, she's going to be sending that report out to all those who participated, but the report is available to everyone on the change package. And there's a nice executive summary on there if you're interested. So the original 5 goals, as I mentioned, it kind of started out as chronic, but we realized to understand chronic, you've got to understand other core definitions like housing and homelessness and transitional housing and how communities are defining those. And we wanted to, again, identify your plans to align with the new federal definition, what that looked like, when that might happen, what support you needed, and for us to think about how are we going to just sort of store and record the information about how you define things in an ongoing way. That was some of the thinking as well. So those interviews took place, as I said, over the summer of 2019. Communities were asked 35 questions, and we had 8 of our own team and 4 representatives from Reaching Home test the questions. So that's not part of the results, but we answered the questions ourselves just to make sure they made sense and they were good questions. And then 20 communities participated, 18 over the phone, 1 in person, and 1 written response from these 20 communities. So thank you to all of those communities who participated. And we recognize that your work in your community is constantly evolving. So what you told us back in the summer may not still be true. We totally recognize that, but I think the information that you provided was really helpful to understand context and what was happening. So the results of the report are organized into 7 sections, a bit of community context, some information about what people said around general definitions and how you're applying them, the work that you're doing with your Indigenous partners around data and data sovereignty, your definitions around chronic homelessness and the new definition from Reaching Home, and future projects. So we also asked if there was other areas you wanted us to dig into, and those are identified there. So we're in the middle of just thinking about our next steps around some of these that turned into recommendations around advocating for prescribed definitions and measurements to provide clarity to communities, and in the meantime for us to start on our own definition and measurement glossary to support you and in consultation with you and as a resource that we could then use as we engage in that conversation across Canada. The storage, as I mentioned, of the definitions and measurements, Indigenous data and sovereignty, and those areas for future consideration. So now moving into a section on new and updated resources over the last quarter. So I'm going to just pause and see if we had any questions. Not yet, but as we go through, if you're like, what, you went too fast, and I am moving through it fast because there's a lot of information, and I know I'm sending all of this out to you afterwards as well, but please do ask questions as we go through. So just a summary, because I think sometimes things come out in bits and pieces, and I think it's nice just to remember what are all the things that are new and different over this last quarter. And one of the big things is the updated monthly data submission form that was released and people could start using in December. So now everyone can submit veteran data if they wish, and they can report when improvements have been introduced in your community. So to help kind of contextualize some of those changes in your data, to talk about when you've made changes in your community. And there are now 2 data submission form tracks. It's still one form, but based on your community and where you're at. For those who are pre-quality by name list, we really are just asking you to submit data on the 6 key data points for chronic, so that you are not overwhelmed with additional kind of data requests and can really just be focused on that. And then for those that are post-quality, you have the option to submit some additional information. It's totally voluntary based on whether you find that helpful in your community, but people can now break down inflow into new chronic being added to the list, as well as people who were on the list but have now aged into chronic homelessness, and breaking down your chronic data into some subpopulation data. So chronic unaccompanied youth, chronic families, and chronic Indigenous peoples. If you are a pre-quality by name list community and you are dying to also start answering some of those data questions, we can make that change in the form for you. But again, just wanted to keep it focused and not overwhelm with a bunch of other additional data options. And that, of course, led us to updating the performance management tracker. So we've cleaned it up a bit. It's got a bit of a cleaner, more consistent look. If you are a pre-quality by name list, you have 2 tabs, so all of your monthly data and your scorecard overview, which used to be split to 2 tabs. There was one for by name list and one for coordinated access. For everyone, that's now been combined into 1 tab. If you have submitted information on additional populations, you can now filter that data by any of the populations you have submitted data on. And for those that are post-quality by name list, that's when you get additional tabs unlocked, because once you have that quality data, we can start to look at your active homeless dashboards. So there's the 10 and the 50% milestones, along with a monthly inflow-outflow chart. The next tab is run chart. So you have all those data points in 1 tab. And again, you can sort by different population groups, along with that documentation around your improvement timeline and your history with introducing improvements in your community. And then projections to functional zero that are tailored to your community, again, to help you with the conversation of, you know, what are we aiming for? What do we need to move in order to get there? So that is what you will see in those resources. There's also an updated community progress page. So we always had the chronic dashboard by province. We've now added a separate veteran dashboard by province to identify community progress in those areas. And it looks like this. And I'll just sort of highlight a couple of the changes. We broke out the coordinated access into the Reaching Home Minimum Coordinated Access and the CH Basic Quality Coordinated Access. And we're now not calling it below baseline, we're calling it reduced chronic by 10% and reduced chronic by 50%. Just felt like that was a bit more clear. And we have done some updates again to the look of the chronic dashboard. So once you get to a quality by name list, then you have a public chronic data dashboard, or in the case of veteran, a public veteran data dashboard. And so this is just some of the changes that have made there. And I've linked in a sample of Guelph-Wellington's. So for communities with a quality by name list, it's the total active chronic homeless chart only. We used to also do the moving chart, but we just have the chronic active. And instead of the median, we're now showing the 10 and 50% reduction milestone lines. And it's been reorganized a bit to, I think, better tell the data story in a more summarized way. The aim was to have a cleaner look and for it to be easier to read. And thanks always to Randall and Ellery, who is our master tool and infrastructure development person who makes all of these resources super user-friendly and nice to look at. So another new resource over the last quarter is the 2018-19 evaluation report was completed when we moved this model to Canada, and we had a few different options of the collaborative, the in-person, the virtual, as well as self-directed. We wanted to understand what was sort of the impact and benefits of each of those different approaches. There was a variety of data collection methods, including a survey that many of you would have participated in over the summer of 2019. It was really to look at our existing supports, what was working and not working about those, and how we can improve our supports to you. And there's 12 key recommendations that came out of that, many of which have already begun to be implemented, and I've linked in the report there, but it was distributed early in January 2020 with the newsletter and is available on the change package under the action cycle summer-fall 2019. Some other new resources, the functional zero Q&A was updated and kind of reorganized. So this is all the common questions we get about functional zero. We've now added in information about veteran and the veteran definition in there as well. Our French website has now been fully updated and aligned with the English site. When we moved from 20K homes in March of 2019, we needed to make a bunch of changes on the French side as well. So that's now all been aligned. We have a process in place to keep that updated moving forward, although there's sometimes maybe a slight delay. We post it up on the English, we might be waiting for a translation to post it up on the French. And just to say that we translate as much as we can, but there's tons of third-party links to third-party resources where, you know, we'll link if there is a French one already translated, but we don't have the capacity to translate all the third-party resources. We've offered some new policy templates. So we always had the inactivity policy key considerations and examples, but we've now just created an inactivity policy template in a Word document. So it's kind of a fill in the blanks, hopefully to make that easier as you're working on your policies. And we created one that didn't exist before for timely and accurate update as well. So those are Word documents just hopefully to help you as you're developing some of those policies. And then there's been lots of sample community documents added to both the by name list page under privacy, consent, and data sharing, and then on the coordinated access page, lots of tools and community examples. And we're constantly updating that. So if you're looking, you know, to have someone else done this, or is there some document I can, you know, start working off of rather than doing that from scratch, you can find those there. A number of new blogs since late October, and I would say if you didn't read the importance of urgency in ending homelessness and you're feeling a little down or unurgent, it's a great one to like get you jazzed up again about the urgency of the work that we're doing. And I would just also highlight the bright spot, the 32 communities. That was the place where we really showcased all those communities who got to reaching home and basic quality coordinated access. And we had a whole group of new communities that got to quality by name lists that are highlighted in there as well. We've now completed the sort of coordinated access foundational series. So we've been doing monthly webinars, and we've now completed kind of those basic, the entire coordinated access process, and those are available. They're 1 hour. OrgCode did the one on access assessment, prioritization, and matching and referral, and those are just super great webinars as refreshers or to think about deepening the quality of the work that you're doing in your coordinated access system. You can find all of that on the training and technical assistance website, as well as all the other community practice calls and the webinars that we'll continue to have. So just wrapping up what happened for the 2019 conference and then talking about 2020. This last conference in Edmonton, there was a record 1,500 people that attended. It included the most people with lived experience attendance ever at over 150. And again, that's partly supported by an extra lived experience fee that everyone pays on their conference registration. So thank you to all of you for supporting so many people with lived experience to attend. We had, again, more streams than ever, more sessions than ever. There were over 300 presenters and 86 sessions. And I want to especially thank all of the Built for Zero community presenters. I think that as a group, you had such a strong presence and so much expertise to share. And we, the Built for Zero team had curated the by name list and coordinated access as a new stream. And again, many of you presented and did such a great job, and we appreciated that. We are doing that again this year. So welcome your ideas and suggestions and presentation ideas for that stream. And all of the materials are now available on the 2019 website, including keynote speeches and the conference presentations that were shared. So we're now into 2020. You might have seen the blog that went out last week or earlier this week, saying that the website's now available. You can now register, and the call for presentations is open, and those are due on April 3rd of 2020. And just a reminder that there is a registration discount if you are a primary presenter in a concurrent session. Allied networks. There's just been a lot of work going on in this area, and encourage your community, if it makes sense, to get plugged into some of these. So the Canadian Network for the Health and Housing of Homelessness launched at the November conference and is continuing to do work. They now have a website page. Also the National Women's Housing and Homelessness Network, they're doing a big research project. They now have a website page. The National Alliance to End Rural and Remote Homelessness has their website page. You probably saw a lot of the announcements that went out around the launch of the National Right to Housing Network. Again, they have their own website page, so lots of work there. And Michelle Billick, who had been working with the Training and Technical Assistance Program, is now supporting all of those groups as the national field organizer. You can link to all of those networks from the CH Allied Networks website page off the main page of the Community Alliance website. All right. So that was sort of a summary of all the activities and things that have happened over the last quarter. We're now ready to move into community and campaign progress. And as always, we do that with a focus on the sort of the milestones that we have seen be successful in supporting communities to get to functional zero. You can always see the progress on the website on both the homepage, and the difference now is we've also added a bar for ending veteran homelessness. But under Track Our Progress, you can always find the map of communities, how to connect with communities, community progress, and campaign overall progress and resources. So by name lists. This is the bar that you will see in your performance management tracker on the scorecards page. So just walking through the steps to get towards a quality by name list, and those are listed below. Many of you are familiar with those, so I will not go through them, but you can go back and refer to them. We now have 15 communities that have achieved a quality by name list. Most recently, before and receiving scrolls at our learning session were London, Moncton, Peterborough, and Stratford Perth St. Mary's. And you are getting a sneak peek. We're announcing in our newsletter on Monday that Red Deer has just achieved a quality by name list, so congratulations to them. And there's been lots of progress on the quarterly scorecard. So we baseline people's scores because you can update them at any time, but we kind of lock down the scores and record them for this quarter. So this is where we're at in February 2020. We have a number of communities that have identified self-reported 11 out of 11 and maybe awaiting confirmation and or are now submitting their subsequent 3 months of data or setting their baseline. There's a number of communities that are getting close and on their way, and some that are in the getting started, but I know all of those communities are working hard and they're ready to launch some things that I think will move them very quickly up in those scores. I wanted to compare that for you with just last quarter. There's been lots of progress. Like you can just see, even just in terms of looking at it, that communities have moved places, that like the number of communities is moving up in these scorecard levels. All of those communities that identified 11 out of 11 have now got a quality by name list. Those that were getting started have largely moved up in their scores as well. And we also now have veteran by name list scorecard baselines. Fort McMurray is waiting to move through the confirmation process, and the others are working away hard on those veteran scorecards. So we also recognize and shrink the change of looking at how are we doing on data submissions and getting those 6 key data points. And so you will have remembered in the past this rainbow colored ladder or triangle pyramid, and that has now been updated with some new colors. So the same thing, but some new colors. The chart on the right is the one that goes out with the monthly data reminder, and you can see over this last quarter there's been lots of news where communities have started submitting data or reached a quality by name list and are now maintaining at that 15% margin or getting to 100% balance. So this is just a way for us to recognize kind of the linear progression moving through the submission of these data points. And it really is a submission of data rather than reporting data to us. We don't have reporting for accountability. We are encouraging data submissions for improvement. It's kind of an investment, like submitting or depositing money in your bank account. We know this is the kind of data that folks need to functionally end homelessness. And so we're supporting you to collect and then visualize that data. So this is just a summary of the totals in progress over the last 4 quarters. So in each of the levels, 4 new communities have been added. It's not the same 4 communities, it's different communities, but definitely progress up this pyramid. And then we do also collect where folks are at in sort of their progress of HIFIS 4 implementation or HMIS, who's in the planning phase, who is launched and is doing staged implementation, who is implemented system-wide, and who is not planning or offered use of HIFIS 4, but what HMIS are they using. And then the ones with the stars are who has started to connect that HMIS or HIFIS work to their by name list, that it's either holding their by name list entirely or they're cross-referencing from their Excel by name list. This is as accurate as we know it right now, or we've been able to record it. If you're seeing your community there and you're like, that's not right, please let us know and we'll make the update. And we're working on a way to have a better way to kind of record and keep track of this going forward. And you'll see it's not just the Built for Zero communities. We've also included the other designated, Reaching Home designated communities that are working with the Training and Technical Assistance Program. All right, moving on to reduce. And we have communities who have achieved and sustained reduction milestones. And I'm sorry, Dufferin, I've cut off some of the people in this picture here to make it fit, but those who have reached and sustained at the 10% below baseline, Chatham, Kent, and Guelph-Wellington, and Dufferin was the new one over this last quarter. We've also had communities in the past who have reached that milestone and then either have improved their data or you know, things have happened in their community that have brought those numbers back up, and they're close and working to bring them back down again. So Chatham, Kent, you'll see that dotted line is the 50% milestone. So they're also getting very close, and they have a goal around that 50% milestone. They currently have a 39% reduction. Guelph-Wellington also is aiming for that 50% reduction. They currently have a 29% reduction in chronic homelessness, and Dufferin County is at 26%. You can see they're at 14, so they are getting very close in numbers to functional zero and have some big aims and plans around that, as you might have seen in the recent blog that went out about that. Onto the coordinated access scorecard. So same thing, this sort of progress bar is in your performance management tracker in the scorecard tab, sort of saying what are those steps towards getting a Reaching Home kind of minimum requirements for coordinated access and also basic quality. And we recognized at the last learning session these 7 communities who had reached that, have been confirmed as having that Reaching Home coordinated access level, and 2 that had basic quality coordinated access. There's a number of more who are getting there, and we're in the middle of working through some of the confirmation processes. So this is the Coordinated Access 2.0 quarterly baseline that we've locked down for this quarter. And then finally, we always do this sort of progress ladder, community progress summary on the milestones, just kind of putting it all together in one place. And in terms of let's get excited, I'm going to go back a little blast from the past. This is the old one from 2 years ago, April 2018. And you just notice we didn't even bother putting more red bars because no one had sort of moved beyond that. And there's some different communities here than who's currently in, but there's some that were not even yet on the milestone. So many more just at that beginning, kicking off or working on their by name list. And I'm just going to go back again. So just visually, the progress that's been made in the last 2 years is really amazing. So a sneak peek. This is probably what you've been waiting for. What is coming up? So there'll be some announcement about this next week, but we're excited to welcome Lisa Bell as an improvement advisor who will be backfilling Ashley Vandermark, who will be on her maternity leave. So Lisa starts with us officially on April 6th. She will have some transition time with Ashley, who is planning to depart on April 24th and then return to us in 2021. So impacted communities have received an email regarding transition plans, and you can read more about Lisa's background on our CAH team page. So welcome to Lisa. As I mentioned, we're going to have an updated data rulers chart and approach. And so things that I would highlight on here that are going to be different, just at the very, well, we're going to have one for chronic and one for veterans. So that'll be a change that you will see. We've really just identified that those first three areas are pre-quality by name list. We'll show who has achieved quality by name list, and then the post-quality by name list, 15% and 100%. So just clarifying what some are pre and some are post. We'll also have the most recent reported months listed. So you'll see that there as well. And we also recognize that there were communities who were submitting data, but perhaps not move-in data as their first point. That was really sort of a holdover from the 20,000 Homes campaign, where we were counting up rather than really being focused on counting down. And all of the 6 data points. So now we'll recognize communities here after 1 month. They don't have to wait for 3 months. We'll recognize you if you have 1 month of chronic by name list data point, 2 to 5 chronic by name list data points, or all 6 by name list data points. I'm seeing some chats come in here, so I'm just going to check those out. That's right. Randall is just wanting me to emphasize you don't have to wait for 3 months to be recognized here as a data ruler anymore. We'll do that after 1 month, because we could hardly wait 3 months. We were so excited when communities started reporting data. We wanted to shout it from the rooftops right away. So this will now allow us to do that. And this is the new chart that you'll see that will go out beginning with the April monthly data reminder email. And we're planning some updates to scorecards and tools. We're going to be batching a number of small updates and tweaks to the tools that we're planning to roll out in May. And the reason being is any change that we make, we have to go into everyone's individual scorecard to make that change. So we want to do those all at once. We want to be able to communicate any changes to you all at once. And so I'm going to just share some of the changes that we're thinking about, but at the bottom point on the slide, that we welcome any input you have over in March to make the tools better. So if there's a question on one of the scorecards that you get hung up on and would like us to word more clearly, or if you have another idea around how we can make these tools more useful, we would welcome that over March. Please speak with myself or your improvement advisor. So there are 4 tabs in the scorecards and tools document. The first one is about your community. It provides a bunch of context to help inform the rest of the scorecards and tools. And we're looking to add a question about progress with HIFIS implementation again. So it's not resting somewhere else, it's all in one place. The by name list scorecard, currently I don't think we're planning any changes, but we will review the questions, just a good review to make sure they're as clear as possible if we're going to make any wording tweaks. Coordinated access scorecard, there's some wording changes planned for current questions to better align with the Reaching Home Coordinated Access directives and guides. So again, just small tweaks there. The provider participation tool is the one that is going to have the most changes. We're going to be adding the date last updated and the person last updated fields like we have for all of the other tabs. It's just missing on that one, so we're going to add that in. We're going to add in a column for service manager or community-based organization funded programs. So right now it lists if they have Reaching Home funded programs. Sometimes we've already added in this tab for communities. It may primarily be most useful for Ontario and Alberta, but perhaps not exclusively. So it's a chance just to say who are all of the kind of homeless service organizations funded in your community that are funded by a service manager or a lead of some kind, and then of those, which ones are Reaching Home funded. So just to give us a bit better picture of where some of those leverage points are and programs that are connected and funded for homelessness. We're just clarifying that HIFIS when we list it. If it's not, if you have an HMIS, it says HMIS, but if it's HIFIS, we're talking about HIFIS 4 and not HIFIS 3. We're going to be removing the distinction between chronic and all. So right now there's adding and updating for chronic, adding and updating for all homelessness, and we're just going to have it be all homelessness, or just generally, or people adding and updating. Then you can have that further conversation and context around what that means in your community with your improvement advisor. We're also adding 4 other questions to assist with coordinated access and completing the coordinated access scorecard. So So we've had requests to add how many housing resources does a program or provider commit to individualized, prioritized on your by name list or coordinated access. So, you know, when you're coming around the table around coordinated access, who is offering resources? We already asked that question, but now we're saying how many resources. So communities would be entering the number of units or the number of subsidies or the number of case management spaces where that makes sense. And then there'd be another question, just does that particular program provider operate more housing resources than they are committing right now to your coordinated access process? So this is to help communities get more clear on, yeah, who's coming to the table with no side doors, kind of participating in your coordinated access. And then are those commitments documented? Are they in an agreement? Are they in an MOU? And are the eligibility requirements for each of those housing resources known and documented? So again, those are all pieces that are part of the scorecard. So again, we welcome your input, and we have tested some of these changes with communities, and you might hear from us, or we might ask you questions as we're working with you over the next couple of months about some of these pieces as well. So we are beginning to lean into a big city strategy. We hypothesize, and I think big cities would say, you know, some of the challenges of the work that they do looks a bit different than a medium or a smaller community. And Carrie is taking the lead on strategizing ways to best support big cities in ending homelessness. You know, when we reorganized the caseloads with improvement advisors, we're intentionally keeping and kind of grouping some of the larger communities with Carrie. That doesn't mean other larger communities aren't going to get plugged into the strategy. They will, but Carrie does have Edmonton, Ottawa, Toronto, and Winnipeg. And we're linking up with the leads in the states in community solutions and the Built for Zero there, because they have a big city strategy. So we're looking to learn and leverage some of the work that they're doing, and also think about how we can connect large cities in the US with our large cities in Canada, again, for peer support. And we are actively seeking resources to support this big city strategy, knowing that we really need to reduce the caseload of how many communities a particular IA or system improvement lead would be working on with those communities. And we are building capacity for improvement, both within our team and seeking to do so within communities. This is one of the key approaches of Built for Zero, is using this improvement model, these quick tests and iteration to make shifts and respond to homelessness as a complex and dynamic problem. And so our Built for Zero team is reading the Institute for Healthcare Improvement Guide, which is a 500-page guide of everything improvement related from the Institute for Healthcare Improvement. And some community leads have started reading this document as well. I've linked it in case you're interested. Upcoming group coaching this action cycle is focused on improvement, and I just linked in the sign up there, but there's one coming up in April on how to think about the implementation of a change idea, and May 5th, so you want to be an improvement expert. How do we build capacity of you folks in communities to do this work? And you may be even saying as you're listening, what do you mean by the model for improvement? And in our last newsletter, we had this great summary video that explains what the model for improvement is all about. So I've linked it in there as well. All right. So I have worked through all of those things very quickly. Thank you for listening to me as I went through all that, but would love to hear any questions of clarification or ideas that you have. So we are opened up for questions now or comments. And perhaps even you could just share a comment on something that stood out for you, or that you were interested in, or that you were surprised about. Just trying to get a little back and forth here going with the group. So please chat something in the chat box about what you just heard. Is anyone out there? Anything that stood out for you? Oh, thank you. The comments are coming in now. So I'm looking up the improvement guide on Amazon. Absolutely. It's a free resource that you can get off the Institute for Healthcare Improvement website, and the link I've put in there is to a PDF version of that. So I think if you want to order like a hard copy, then there would be a cost to that, but if you're just wanting to read it online, it's available for free. And interested in recommendations from the definitions report. That's great. Yeah, I think one of the big sort of findings from that is we realize people are using some pretty different definitions, and we're seeking guidance on, definitions, and that it's a kind of a complex area, and it would be helpful if we had some clear definitions. It's nice to see the progress of communities over the past 2 years. I agree. It's super exciting. There has been lots of progress. Any other final comments? All right. I appreciate very much everyone joining us. We'll be sending this presentation out to you shortly, and likewise in York Region, we've been focused on definitions, so we'll be interested in reading the report. That's great. Okay, well, have a wonderful weekend, everyone, and we will be talking with you more shortly. Take care.